Hi, everybody, and thank you for coming tonight. My name is Student K. I'm a public health advisor with the Centers for Disease Control, and I'm here this evening to talk to you about the flu vaccine. I know that you've all probably heard about the flu vaccine on the TV or through your local media, or you've seen the signs. And what I want to do is talk to you tonight about the facts and why the flu vaccine is important, what it can mean for you and your family, your schools, your workplace, and your community as a whole, why that's important. If you have any questions, please feel free to stop me, or there will be time to ask those questions in the end. So, what is the flu? The flu is often used interchangeably as the common cold. People just use it to describe feeling bad, when in fact the flu is a virus in and of itself. It is an influenza virus. There are two types, type A and type B, both of which can cause the seasonal flu that we think of. This virus does attack the respiratory system. The respiratory system is an organ system that includes your lungs and is responsible for taking oxygen from the outside environment and making it available to the cells in your body. Helps you move fast and think clear. Now, the flu is different in that it looks differently under a microscope, but in everyday life, it has different symptoms as well. I've included a graphic on the bottom of this slide to kind of follow along and outline some of the common symptoms you see associated with the flu. There are some risks associated with developing the flu that are a little more severe, and I'll cover those in just a couple of minutes. However, the symptoms of the influenza virus can start from the head and move all the way down the body, including a headache or dizziness. You can have a runny or stuffy nose, a sore throat. You can get a fever, chills, muscle and joint pain, coughing in your lungs, vomiting, any number of symptoms, all of which can really knock you down for a couple of days if you come down with these. It can be very hard to go through and perform your daily tasks with extreme head pain and a severe cough. Now, the risks that I mentioned are a little bit more complicated and a little bit more severe. The symptoms that I talked about can persist for up to 2 weeks with a flu infection. They don't necessarily last 2 weeks, generally anywhere from 5 to 14 days. These symptoms can over time weaken your body and can lead to more severe diseases or complications. These are known as secondary complications, and that means that they don't come from the flu virus itself. They come from the effect of the flu on your body. These risks can include development of pneumonia, bronchitis, ear infections. Those are exceptionally common in our children. Asthma attacks for those people prone to asthma-related problems, the most severe of which is death. We certainly have a number, hundreds to thousands of flu-related deaths each year. These can be very severe. It's certainly not something to be taken lightly. The flu should be respected. And what I want to talk to you is about how it's spread and how you can keep from getting it. Now, the flu is spread through direct contact, and that can be touching other people, direct exchange of flu particles through kissing or sharing a toothbrush, people who bite their nails or pick their nose or are constantly putting their fingers in their mouth and on their face are certainly more prone to spreading this virus. The number one way it is spread is through coughing and sneezing. When you cough and sneeze, little water droplets come out of your body and enter the space around you. Now they can land on a surface, they can land on another person can walk through a spray from a cough or a sneeze. Once they inhale or ingest these flu particles, they can become infected. So it's a very easy to spread this. It can also be spread through sharing materials, especially those that are on or near your face, such as linens, like your pillowcases or dishes, drinking behind somebody, sharing silverware, anything like that can be very easy to spread this virus. One of the things that makes the flu so contagious, meaning easy to spread, is that you can actually spread the virus before your symptoms even start. Up to a day before you get your first chill or headache or sore throat, you can actually be contagious and can be continuing to spread this. You're certainly contagious while you're sick and even for a few days after you start to feel better. This is why it is so important for you to stay home if you are feeling sick. Keep your child home from school. Call out of work. Don't go to large groups of people where you can easily spread this. If you must go out, which let's face it, we do have to run errands, we do have to go to the grocery store, anything like that, it's safest to wear a mask. If you're wearing a simple mask that will cover your nose and your mouth, this will prevent you from spreading the virus on to other individuals. Now, who is most at risk for developing the flu? Well, everybody can develop the flu. It doesn't discriminate based on age or sex or gender or economic status or health status. The healthiest and the poorest of health can all get sick with the flu. Those most at risk include our young children, mostly under the age of 6, can develop a very severe flu infection. Also, those over the age of 65 who may not have as healthy of an immune system to fight off the flu can be very much at risk. Also, those that are health compromised or immune compromised. Those can include people with HIV or with hepatitis, cancer, those using steroids to actually stop their immune system are certainly more at risk for developing these severe complications associated with the flu virus. Women who are pregnant also are immune compromised and are more likely to get sick. It's important that we protect these members of our community that are not as able to protect themselves. Now, there on the flip side, there are some people that pose more of a risk or a danger. These are people who expose themselves to many groups of people on a daily basis. These include caretakers of children or elderly, such as teachers at daycares. If you have a classroom full of healthy 4-year-olds and a sick teacher comes in, she can certainly, through her interactions on a daily basis, expose and infect these children with her virus. And then you have a classroom of sick children. Also, healthcare providers such as doctors, nurses, hospital staff come in constant contact with many people. It's very important that they stay healthy and don't pass any of their germs on to those that they are interacting with and ultimately trying to help. Also, people that handle food, anything that we're going to ingest in our body, it's very important that they stay healthy so as not to contaminate food or our dishes or silverware with any sort of germs that they may have. Again, if you're feeling sick, stay home from work. It's not worth it. Now, what is the vaccine? How can you protect yourself against the flu? How can you prevent yourself from getting the flu? The best offense of the flu is certainly a good defense, and that's where the flu vaccine comes into play. Now, this vaccine has been updated on a year-to-year basis. As you can see down at the bottom, there's a picture of Fluaval. That's last year's vaccine. You can see it says 2012, 2013 formula. That was for last fall and this winter's flu vaccine. There is a new one out for the 2013-2014 flu season. The vaccine is updated yearly because the flu is a smart virus. It adapts to changes and it adapts to vaccines. As it changes, we must also change how we're fighting against it. So every year, a lot of very smart people get together and look at the newest strains of the flu virus and develop a vaccine that's most apt to protect you against that. Not only does the flu virus change and require us to get a yearly booster, but also our immune system requires us to get a yearly booster. The vaccine simply doesn't stay in our system that long. Like I mentioned before, getting the vaccine is not only for your own protection, it is for the protection of those around you. There are hospitals and schools and daycares that won't let you enter the building unless you've been vaccinated. This is not for your safety. This is for the safety of everyone. Now, the flu vaccine is readily available. It comes in multiple forms. There's a shot form and also a nasal spray form. The shot form is an injection that's given in the upper arm, in the bicep muscle. It's ideal for anyone who's a candidate for the flu vaccine. So that is anybody from the ages of 6 months until you die. You're eligible to get the flu shot. It's your best protection. The flu shot is made from a dead influenza virus, and what that means is the rumor that you will get the flu from the flu shot is simply not true. When a vaccine is made using a dead virus, you will not get the virus from the shot. This vaccine is safe for pregnant women, which is important because they need the booster to keep them safe during their pregnancy. Also, another benefit of this shot is the minor side effects. The side effects generally include soreness at the site of injection, can mean a small bruise, perhaps some aching of your arm for a couple of hours, perhaps a day, generally not more than 24 hours after you receive your vaccine. Can also develop a mild fever from the shot. All in all, the side effects are fairly minor compared to actually getting the flu itself. Now, if you can't stomach the idea of getting a shot, or if you have a phobia of needles, or a child who it simply is not worth the fight to give a shot to, there is a nasal spray. Nasal spray is called Flu Mist. It's sprayed directly into the nose from a syringe that does not have a needle included. This is not ideal for everybody. This is best for those between the age of 2 and 49, simply because those individuals under the age of 2 and above the age of 49 require better coverage than the nasal spray can offer. This is made from a live virus. The virus has been weakened, so again, you will not get the flu from the vaccine. It does, however, include some more moderate side effects. These side effects are mostly from the actual administration of the vaccine and not the fact that it's made from a live virus. The side effects include runny nose, or a cough or a sore throat. When the virus is administered to your nostrils, it goes down the back of your sinus cavity, down your throat. This can cause some irritation, which can lead to a cough. It can also cause a headache. But even with these, again, this is not as bad as getting the flu and being sick for 2 weeks. I've included a couple of pictures of the shot versus the nasal spray. As you can see on the left, there's a picture of a woman getting the shot in her arm. It's in her upper bicep. It's a small amount that's injected, so you're not very sore. Be sure this is given by a healthcare provider. And on the right, you can see a young boy getting the nasal spray vaccine. They generally close one nostril and just shoot it right up the other one. They have you tip your head back and it drips down the back of your throat. Now that I've told you what the vaccine is and how important it is, where can you get it? How available is it? Well, the answer to that is it's very available. It's very easy to find. It's very easy to get. You can certainly get it from your primary care physician or your local doctor to call and make an appointment. You can get it from some hospitals. Some hospitals actually require you to have it before you're able to enter the hospital. Also, the most popular are the walk-in clinics. Now, these you see everywhere. They're mostly at pharmacies. You'll see the signs on the doors or out by the road. It says flu shots available, vaccine clinics today, any number of slogans to take you in and to get you to get the vaccine there. It's offered at CVS, Walgreens, Target. Any local pharmacy can provide you with a flu vaccine. Other sites for walk-in clinics include universities and workplaces. They will generally run clinics on a yearly or monthly basis to provide those who don't have the time to go to your primary care just to receive a vaccine. You can get them there. Generally, there's a little bit of a wait when you go to universities, but it's worth the wait. The last way you can get it, for those members of our community with mobility issues that perhaps don't want to wait in line for an hour to get a vaccine, are the drive-up clinics. In your area, there will be clinics where you can simply stay in your car and drive up. The doctors there will have you fill out a form, and then you will be administered the shot as you sit in your car. It does not get much more convenient than that. So that's all the information I have for you tonight on the flu vaccine. I hope that it has been able to answer some of your questions about why the vaccine is important and how you can get it. If you have any questions, I'll be happy to answer them now. Thank you for your time.